item on page 31 from the plan that we filed with New York State. Last time we started with the beginning of the action item, which was on page 24 of the plan. And we got through almost to the end of page 31. So we're just going to go through like we did last time, check in on the status, see where we're at, see if there's any pending actions that this committee should be putting into our work plan. So
are you seeing the plan?
I am.
Yes.
Yep.
Okay.
Yep. And if you don't mind, Sherry, just scrolling down a little bit, I can see the top three, but not the last one. Perfect. So we're going to start with that. Community relations, create a community survey to measure overall satisfaction of Columbia County law enforcement and people's interaction with them. The survey would be conducted annually and anonymously in order for residents to feel safe providing feedback to law enforcement without fear of negative consequences. Data would be compiled by the Public Safety Committee of the Board of Supervisors. I believe that was one of the tasks for the Sheriff's Office. I wanted to check in with the Sheriff's Office to see if you guys have worked on that at all.
For us to create the database for community, I was not aware that that was a task for us. That's monumental. We honestly do not have the resources to even begin to compile that and put that together. I mean, we barely have resources to cover shifts, so.
So
no.
Rob, that could be a job for this committee to start looking at what survey questions are we asking. And I imagine MIS, once we have the survey questions, MIS could help us create the survey and then we can get it out to the public. I mean, it is the Public Safety Committee that'll be compiling the data. So it might make sense for this committee to create the questions and get the survey going.
I'm just reading the verbiage again.
Yep.
I mean, that's going to, again, I think similarly to her response, I'm not sure how the Public Safety Committee would compile this information. I guess if we did a survey that we could, do online somehow, that the data could be compiled fairly easily. I mean, because as you know, history of the committees are not going to sit down and compile thousands of surveys.
We can work with MIS. We can use a Google Doc. We just did a survey through the town. We got 240 responses. There was no work other than, I think when it says data would be compiled, I think it's more that we're going to review it, right? It's going to come.
But I think the verbiage that the verbiage should be changed to say that the Public Safety Committee will review the data or review the conclusion of the
survey,
as opposed to the way it says.
So could I get maybe 2 or 3 volunteers from this committee to work between now and the next meeting to come up with some survey questions? And then this committee can review the proposed questions. I think this requires maybe a meeting outside of this committee meeting.
I'd be glad to help with that.
I'm happy to help as well. Is there 1 or 2 more members that would like to?
So all of the questions that are going to be part of the survey will also be presented to the committee prior to going out for the survey?
I think that if we can have a subcommittee kind of work on brainstorming what some of the questions should be, then we will email them in advance of this committee meeting to everyone. Obviously, we want the feedback from the Sheriff's Office, rewording, removing questions, adding questions that aren't in there. But I think that's a good starting point, is to have a group of us kind of start brainstorming what kind of questions would you ask the public. And then absolutely it would come through this committee with both your and Sheriff Kraft's input before, and then we'll go to MIS once this committee has said, okay, here's the 10 questions, then we would go to MIS and have them put it into a survey, easy to compile kind of Google Docs.
So we see this survey being done, whatever, January 1st, returnable February 1st kind of a thing. And then, the information would be compiled and it would be in front of the Public Safety Committee potentially at the February or March meeting. Is that correct? Is that how we see this happening?
It doesn't say a time frame, but it's annually. So, we could do it in summer, we could do it in winter, we could do it, fall. But it's an annual survey. And I think that the point of this in the plan, and I actually really like the idea, is for people to feel comfortable sharing suggestions, ideas that then the Public Safety Committee can share with the sheriff's office. Hey, the public feels uncomfortable answering these questions. Is there a way that we can ask them differently? Whatever the outcome of that survey is, really just having a mechanism to hear from the public as to what's working, what's not working. So Dave and I have Bill, are you able
Yeah,
to?
I was just gonna say, I'll work on depending on the schedule, but you can put me
Okay.
down tentatively.
Okay. Awesome. And then if anyone else doesn't have time to have a meeting outside of this meeting, but you have ideas of what you'd like to see on the survey, just email them to me and then I'll add them into whatever the committee comes up with. And we'll have something for next meeting. All right. Sorry, I'm just taking notes so I remember to do that. Okay. Next we have procedural justice and community policing. All CCSO and partnering local police department members are trained in anti-bias, discrimination and harassment, ethics, and law enforcement ethics. This will be included with the annual in-service training. And the county action is 2 deputy sheriffs have received specialized training and are now certified and structured in principled policing / procedural justice, 5/19/17 and 11/19/20. Zone 14 Academy to roll out additional in-house training utilizing the 2 newly trained instructors. So Jackie, this is a status update with your department as to where that's at.
I just asked the first sergeant to go and get me the names of the 2 deputies who are trained, because I'm not certain who they are. And then we can have a sit down and see where they are and make sure that they, are at least trained to, they should be, according to this, they should be trained as instructors. So that it's a train-the-trainer opportunity. So I need to find out who they are, what their status is, and then make certain that they're in a position to be able to train everyone else here.
Within. Okay, so I'll just put it for an update next month, Jackie, and that gives you time, you and the sheriff time to look at where you're at with that.
Okay,
Okay, great.
thank you.
And then the next one, same category, expand diversity and bias awareness training. Low income persons with disabilities, substance use disorders, minority and LGBTQ+ communities, as well as training to recognize systemic racism. And the action is completed implicit bias awareness training for all CCSO officers, current and continuing. So Jackie, just checking in that the implicit bias training is still a continuing training that happens within your department.
Will be included in our in-service coming up in the next couple months.
Okay, great.
I have a question, if y'all don't mind, about what might be included in that training. I know over the past couple of decades, police departments have sometimes attended trainings about Islam that are really sort of biased and off the mark. Is any sort of educated view about Islam and Muslims included in the anti-bias training?
We target any specific, train to any specific demographic. It's just, so my understanding of what the training will entail is for people to be aware that we all have some type of an implicit bias, that they are learned behaviors, and to just be aware of that, but not to target any one specific demographic or population.
Okay, because I see, we're specifically mentioning LGBTQ+ folks. And so I was wondering if, in case there's been damage done over the past couple of decades in miseducating law enforcement about Islam, if anything's been improved in that area, and if there's any commitment made to make sure we're getting accurate information about that particular community.
Yeah, we have, the sheriff has some pretty significant ties in the local communities. And they have been willing to come in and help us with basic language skills and anything else we need to know. So that is absolutely an option for us. So we can tap into that.
Great, thanks.
And I believe and Bill, maybe you can correct me if I'm wrong. I believe on this kind of action chart, the category, reform item, and description came from the state. So the state said, here's the categories, here's the reform item, here's the description, and then the action taken is where we used our wording. Am I right about that, Bill?
Yeah, and to Dave's point, some of the language we added in there wasn't real. We didn't really mean it to speak to a specific group, other than to highlight that it should be addressing these groups and others. But to Jackie's point is not to be specific, but to teach, implicit bias as a whole.
Great.
Okay.
And I would imagine, Jackie, I can't speak for your department, but if Dave has some insight or input onto anything having to do with that, he could certainly, have an offline conversation with you or check what the wording is in some of your training and make sure that it is not misleading.
Absolutely.
And of course, as you said, under Sheriff, you do have a Muslim community here in town who's probably way more qualified than I to help guide on this sort of thing.
Mhm.
I just know it's been a problem for Arab and Muslim folks for the last couple of decades, that some people presenting themselves as experts have been speaking to law enforcement around the country, and they're not experts. In fact, they're sort of professional Muslim haters. So I just want to make sure that we're not being guided by those folks, but by actual Muslims.
Correct. And part of the reason that I want to keep that specific training for that demographic local is because we deal with our local community, so, there's different, as in any religion, there are different, breakdowns, different sects, different, whatever you want. So we want to make sure that we are well-versed in what our local community needs. So we'll reach out to those people.
Great, thanks.
Awesome. All right. The next one is also procedural justice and community policing. This is number 3, training mental health and substance use. All CCSO and local police department members receive annual mental health training, and the action is use of force and mental health policies have been updated using the most recent New York State model policy guidelines for providing mental health treatment to those in need. And again, Jackie, just checking in that is still current, that, if any changes in the mental health policy guidelines have happened, that your department is updating your policy as needed.
So for the first use of force always happens when we requalify for weapons. That happens a couple times a year, and that's upcoming also.
Okay.
Very soon for in-service and the mental health stuff. We have reached out to Dan Almasi, and they're going to include us in all of their trainings so that, we're trying to save money and include a lot of the county agencies together, since we're going to be, cross-utilizing resources with the upcoming MAP legislation. So all of those things are in place. And if there's anything that's new, we brought together a significant number of people here at the Sheriff's Office to make sure that we are using best practices and, being exercising a fiduciary responsibility to get the most bang for our buck with the local agency so we can support everyone. And mental health is included in that.
And if I could, Supervisor, one of the things when we brought this up, it was the big conversation was about, having mental health respond to police calls and things of that nature. But also what was important that was brought up is that officers are supported with mental health services. And so I know when the previous sheriff was in office, he was talking about how there were services and how he was trying to set things up so that current deputies and officers would have access to mental health services should they need them. And it was going to go through the county mental health services. So I know that we're speaking more towards that end of things.
And Jackie, can you touch on that a little bit of how the officers within the Sheriff's Department are supported and able to access mental health services as they need to do so?
For those who are unaware, I retired as the director of the Employee Assistance Program for state police. spent 14 years in that unit, getting police officers and their family members access to services. I can tell you that I've gotten a couple people access to services in the past couple of months. Dan Almasi, like every other agency, is stretched to the max, and they are really not able to provide the level of care and services that a lot of people need. It has to really be on an emergency basis, and then we refer people out. So utilizing those same resources that I've been able to develop over the years, we're still doing that for the officers here. I also reached out to the FBI. They have a new SAP, agent in charge, and they've offered their services to us as well. So they're actually going to come down and do some additional trainings for us for free.
That's great.
And to that, if I could again, under Sheriff, I think it will be really important when we're talking about resources, because we are always talking about resources for police in the community and to us, and rightly so. But we also want to make sure that our officers have the proper resources, especially when we're talking about mental health, right? Because they're making life and death decisions sometimes on the street. So if you don't have the resources when it comes to mental health, you should bring that to immediately to the Public Safety Committee and ask for more funding. And it would be a shame on them if they didn't give it to you.
Bill, to chime in on that, it's not about funding. We have so many positions open that we can't fill. So it's only fair. It's not about that we're not supporting mental health department, which we are, as well as all these other departments that have positions open. There are numerous positions open that we have not been able to fill. That's why
Okay.
they're extremely stressed, as opposed to it's not for of a lack of want to help. It's just that we have been really having a challenge filling positions. So that's
And Bill,
what's happening. But
we've opened that up statewide too, to some of the positions for mental health, and we're still not getting applications. And we're paying for advertising and some for mental health positions.
we've even had
social workers.
headhunters that we've paid. So the county as a whole is very supportive of our mental health department. It's just been a real
Right.
big challenge.
So it sounds to me though, like Supervisor, is that maybe we think outside the box like we did with the opioid kind of training. Look to other counties and do a partnership. Maybe we have some resources that they need and they have some resources that we need. Just a thought.
Yep. Thank you,
Gary.
Gary.
Yes, can I just get clarification? Because it appears that most of what we've been talking about was through the sheriff's department, but we have here and local police department members. Are we, are all departments in Columbia County included? I mean, and how are we reaching out to the Philmonts, the Stotvilles, the Greenports of the world? And where do they fall with everything that's being done?
Yeah, that's a great question. And yes, all of the local police departments signed on, with the exception of the city of Hudson. They have their own, but they all signed on to this plan. And so they are also to be doing all of these action items. And so it might be a good thing. I was hoping that they would be on these meetings, but it might be a good idea, Rob, for you and I to compile a list of the actions that have to do with things that they committed to doing, and just getting, at least if they can't attend next meeting and update the committee, at least get a written update from each of them and report it to the committee.
But yeah, Gary, they all did sign on and they should be included. So the next meeting, I think we'll also put out an invite to the head of all of those departments to let them know where we are, and maybe they could answer these questions in person.
Hey, Bill, just to piggyback on that,
Hi,
you know, we how are you? Sorry, I was in another meeting with some stuff at the facility I couldn't step away from. But you know, we have our insurance company here today checking on just making sure that we're in compliance with all the safety aspects for our employees. You know, trip hazards, chemical stuff. We invited them in. They're doing a check today to make sure our employees are safe. We also reached out to a company called DGL, which is a training institution out of Connecticut. That's all virtual. They do a lot of stuff, trainings and webinars. We've reached out to Lexipol. to try to get on board with Lexipol so we can have all their up-to-date recordings and trainings, and we can also push that through. If we missed a training, they'll send us a recording plus all the literature. We had a meeting with Power DMS with a lot of different aspects that they now have that they can implement within our office. But just the mental health aspect is an additional $11,000 a year for them to provide that to us. We don't have the additional $11,000 a year right now. We're looking at $1 million just to get in compliance with the MAT legislation. But we are out there. We are discussing it with other sheriff's agencies throughout the state. We're sharing resources through the Sheriff's Association, through other sheriff's office to make sure that all our employees, whether it's civilian, jail facility or road facility or road division, have the most up-to-date training, that they have the mental health, backing and any other aspects that we can provide to them. That's super important to us. So I'm glad because that's one of the things that we really wanted to touch on here with this new administration. So thank you.
And then if I might add one additional thing, recently at the Undersheriff's Conference, I've been in touch with a few of the undersheriffs around the state. And they have a regional critical incident response team up in the Herkimer area. And we're looking to do that down in this area too, so that we can assist each other in addressing the needs of our members. So.
Awesome. Well, thank you all so much for your hard work and making sure that mental health is accessible by not only the residents of Columbia County, but also the deputies who have a very stressful job. Anything else on that action item before we move to page 33? All right. So page 33 is procedural justice and community policing, collaboration with mental health and substance use services agencies referral program. The Sheriff's Office, in working with Columbia County Mental Health Department, Twin County Recovery Services, and Greener Pathways, has established a referral program to address issues of those afflictive use issues. An electronic form is available to all officers when answering calls and a subject has been identified to be in need of such services. This process will extend to all countywide police departments. Police officers submit the form to the appropriate provider agency. That could be mental health or Greener Pathways. The provider agencies then conduct outreach to the individual who is referred and attempts to engage them in services. The provider maintains a spreadsheet to track the referrals and the outcome. Local service providers will provide training to CCSO staff regarding their services. And the short-term goal was the referral program to be in place for local partnering police departments by 7/1/21, which was done. I was on the original committee that brought this forward with Dan and the prior sheriff. And we did meet with Sheriff Kraft and Under Sheriff Salvatore a few times. And then it was decided that there was a larger group meeting that had to do with the project Cheryl Roberts is working on, the city of Hudson. And so I graciously stepped aside to say, you guys have this. And the program, as far as I know, is continuing and successful. I don't know, Jackie and Don, if you want to give a quick update, because I haven't been at the recent meetings.
Yeah, I mean, we're continuing to do it. We're continuing to have conversations with both Greener Pathways and Twin Counties, and we're in continual contact with Panamasi. We've reached out to some of the other local town PDs. We talked to Chief Doyle with Philmont. They're trying to come on board with this program. Constant contact with I'll call him Sergeant Hike, acting officer in charge of Greenport, who's lieutenant here in our facility. Speak with Joe Alessi in Chatham. They're already on board with this. We're working with the EOC next door. We're keeping that open so we can utilize that for trainings of smaller agencies to work in coordinated effort with the sheriff's office to offer training. We're really trying to get this mental health aspect of law enforcement at the forefront. Just the other day, we lost one of our, I don't really know how to term it, but one of the individuals in our community that was large of the mental health scene, and we just lost him. He just passed away a few days ago. We have another, continuing individual through the mental health process back in the facility. you know, at least he's getting some treatment there. But, you know, this is it's a broader, thing with a broader brush here than just law enforcement. I think we just need to continue our efforts with mental health in order to combat this issue. But we're doing our part here, that's for sure.
Thanks. Anyone else have any questions on this one? All right, we'll move to page 34. The first one is about de-escalation of force and search warrant. All CCSO members and local partnering police departments are annually trained in de-escalation of force. Policies are to be reviewed and updated. Note, de-escalation of force CCSO policy was amended recently to reflect an updated New York State model use of force policy, which was last updated September 2020. Current CCSO policy reflects these September 2020 changes. Current and continuing is threat assessment is done prior to execution of any warrant. Assessment includes presence of children, proximity to schools, playgrounds, criminal histories of subjects involved, time of day, weapon involvement. CCSO does not use military equipment, however, does engage their tactical team when necessary. No-knock warrants will be limited in use and only used when authorized or directed by court order and or after thorough threat assessment deems the use of a no-knock warrant necessary. Several CCSO instructors will be attending effective de-escalation training on March 2nd, 2021, and we'll bring back that training to the remaining CSO members. So looking for the sheriff and undersheriff to update us that these things are still in place and where we were at with your instructors bringing training back to the rest of the sheriff's office.
So if I could, before they speak, because this was an area of a lot of discussion, and it really was around, I know the previous sheriff was saying that we didn't have any military equipment, but it was like the SWAT units. And so the people in the public were questioning whether certain times SWAT units were used appropriately or not. And the sheriff indicated that they were because there were suspected weapons involved. And so then people, and I'm only giving you guys some background, Sheriff, so that you understand how this came about. People were thinking that some of the warrants could have been issued or handled prior to kids coming home or some earlier in the day or things of that nature. Because what happened, we had some youth that were present, and it ended up into the school district where we didn't have the poor resources into those kids who were traumatized and things of that nature. So it became a pretty big issue about how warrants were being handled, especially the no-knock warrants.
Well, just to address that, I mean, first and foremost, we do not dictate how the warrant is signed. The judge feels there's enough, or I shouldn't say how, if the warrant is signed. If the judge feels there's enough evidence there to sign a warrant, then he goes ahead and signs a warrant. Our shared services response team is inactive, so I can't really comment on what the past administration or administrations of several different entities did or didn't do. I can tell you as the former team commander of the tactical unit, our shared services response team, we did a lot of research. We depended on information from the criminal investigative branch from whatever agency or jurisdictional agency was handling it, whether it was Greene County, Hudson, or the sheriff's office here. We acted off of that information and did a threat assessment. A threat assessment would determine whether the team was used or not used, and then we would formulate a plan for what the safest execution of that plan for the whole community was, not just based on who was in the house for the entire community and our officers. So, you know, we don't always know if there's a child in the house. I mean, there's circumstances beyond our control. If we believe the child is gone because he exited through the front door and now somehow went back to the back door, and maybe there's a lapse in oversight. I can't answer those questions because I wasn't involved in every single execution of every single search warrant for the last how many ever years the team has been in existence. I may not even been here, but I can tell you we did very thorough planning. It was based on a lot of man hours of police investigation and data. So In my time in relation to the tactical team and being in command of it, we always did threat assessments, and we would act or not act based on that threat assessment. Currently, we do have multiple individuals trained in de-escalation. We also have the simulator at the college. If you haven't had an opportunity to see that, we would love you to come down and see that. That's just an added aspect of training, which gives you more real world kind of exposure to the threats, even though it's in a room, you're using a sim gun. It does elevate your stress level, and we're happy to bring it down there and let you see that. We're also instituting a real world reality based training where we're using actual sim rounds. We're going back to defensive tactics, implementing those. We haven't done that in over a decade. So when we're out in the street and de-escalation fails, our officers have the training on how to effectively, efficiently, and safely resolve the situation by going hands-on. It reduces the risk of injury to the perpetrator, the officer, and to the civilians in the community. So we're taking steps in order to make it safer, regardless if it's de-escalation or failure of de-escalation. And as far as warrants go, we'll continue to bring them to the judge as we have mandated to do by law, and let them make a decision if there's enough evidence there to sign that search warrant. And like I said, our tactical team is currently deactivated. We're working towards getting that back up and running. But in the meantime, we'll address those warrants, based on what the judge feels is appropriate.
Go ahead, Dave.
I have a question. I have just sort of a bad gut feeling about no-knock warrants in general, just because of what has happened in so many around the country. So while the judge makes a decision, you guys ask for either a regular warrant or a no-knock warrant, right? Who determines which it would be?
Just so warrants as a whole, just general warrants from a police perspective. When we do investigations and we go to an authority, a judge, and we ask for a warrant, the main reason we want to do that, and I think we can all agree that 99.99999% of the time, those warrants are signed because of some illicit drug activity or guns, correct? So the goal is to remove those items off the street and away from children, and to keep other people out of harm's way. The way we get those things is via the element of surprise. Most oftentimes, and every warrant that I've been a part of executing has happened in the wee hours of the morning, typically when people are asleep. Because when you knock on the door and say, police are going to go and flush this stuff down the toilet, or they're going to try to secrete it someplace else. So that, I know we say no knock warrant. So why do it at all if we're not going to do it that way? The goal is to get these things off the street. And in order to do that, we have to use the element of surprise sometimes. And we can't get those warrants signed unless we've been able to prove that there is some evidence via sales or what have you, that these things, and we believe these things to be present. Now, kids are sleeping early in the morning, and is it horrible on the children? Absolutely. But I think the other horrible thing that we don't often consider with the children is, are they going to grow up to think that drug sales is normal activity? So there are a number of things that we need to consider, so, we use the least amount of force that is necessary, hence the de-escalation stuff. But I think that we need to really consider the baseline and why we are doing it.
And Dave, can I just ask a question on, you're saying the no-knock warrants throughout the country and the effects. Can I ask what you're referring to? Because there's been several instances as well that we've done knock warrants which resulted in the death of a police officer. So we have to look at that as well. We can't just look at it from one side.
Yeah, well, I'm thinking of places where, cops have gone to the wrong address and innocent people have been killed. So I'd like to see as little of that as possible as a tax-paying citizen. And so I'm just wondering, what's the advantage? If the stuff is flushed down the toilet, it's not on the street and you haven't traumatized children. So I'm just wondering.
And yeah, I agree with you. I mean, you can't put a price on safety. I mean, and if the cops went to the wrong house and an innocent individual was killed, then that's a criminal matter. Now the cop has to face, and that's something that, you know, I agree with. We need to do the background. We need to do the research. We need to do the investigation. We need to make sure that we do this out of 100 times. We need to get it 100 times right. There's no room for error. That's why you have highly trained tactical units, why you have investigative units, and why you have to have your command structure in place in order to have that tactics and logistical meeting in the middle and find out that you're doing it right each and every time. And you know what? Cops are human. There's that 1%, a little bit of error that could happen. That's not acceptable when you're doing a no-knock warrant. You have to be trained, you have to be ready, you have to be prepared, you have to have that training and information so we do it right each and every time. And, you know, I don't know of any time that the sheriff's office has been involved of anything of that nature. That's where the investigation comes from, and months and months and months of investigation. And, you know, as the undersheriff said, no-knock warrants are sometimes necessary. And I'll be happy to, you know, run through the phases of how warrants act. You know, there's several different ways to serve a warrant. And not every warrant do we go in, you know, and run through the structure clearing it. Sometimes we'll breach the door and we'll do a call out, because sometimes that's what dictates. Other
Don't
times-
forget also that not all warrants are requested by law enforcement. Judges issue warrants, and sometimes judges issue warrants to different law enforcement agencies. They're issuing it. It's coming right from the judge. It's not directly from the law enforcement department. I think that's important to note.
So should we, as citizens of Columbia County, feel like you know, you guys have the training and the resources to make sure we're pretty close to 100% on these?
I'll even offer, once our tactical unit's back up and running, I will offer to have the supervisors come and see some of the training. If you want to put a suit on, we'll get you out there. We'll run you through some of the drills. You know, we'll run you through some of the things we do. We'll put you in a simulator room. We'll let you see some of the training that we do. Obviously, we can't divulge all of our training and tactics, but we'll let you know as supervisors and give you all the information that you can bring back to your constituents that will make them feel safe, and let you know that we're doing our part. You know, I just can't express enough the knowledge that needs to come with some of these questions. I mean, the only difference between a knock and a no-knock search warrant is I go to the door and go, police, and then I break down the door, or I just don't say police and I just break down the door. It's just a matter of seconds. Sometimes it's invaluable seconds when we need to act quickly, but there's not much difference between a knock and no knock. And I understand where you're coming from, but sometimes it's just an officer safety thing where, you know, if it was a hostage situation, you know, it turns into a hostage situation because we're knocking. Now we have that situation. So I understand where you're coming from, where you're worried about the safety of the children. We also don't want the children's safety to be an issue, because now we're standing outside going, hey, it's the police, open the door. We're going to come in and search your house for, you know, 20 guns that we suspect to be in there stolen. We just committed a homicide or a robbery or whatever the case is. So sometimes it's necessary to have that no knock, just go in and apprehend the person as quickly and safely as possible.
So this may be something that can come up in the survey questions that we ask to see what people's level of understanding of this is, because I think a big part of this process has been to reassure citizens on issues like this. And, you know, if there's some way that this can become general knowledge, the seriousness of this and the professionalism of any particular department, I think that might be really helpful in community relations. Just because, you know, we know you guys are professionals and trained to the best that our capabilities and budgets allow. But the average person is reading about botched raids like this around the country that end up in with the deaths of innocent civilians. So it's natural concern on the part of people that, you know, how can we be sure something like that isn't going to happen here?
Yeah, I mean, you know, we've done training with, you know, California, Texas, you know, New Orleans. I mean, we've done training with a lot of these big agencies that, you know, will hook a grappling hook to the building and rip the whole wall out. I mean, we're not doing that. I mean, there's hundreds of warrants that are served every year that are not, not warrants. And, our investigators will go and serve these warrants. You don't hear about these normally because it's a warrant issued for someone and the threat level just doesn't raise to that level of activating a tactical team where now the safety of the community, the safety of the individuals, and the safety of the officers are now at play. So,
Thank you.
thank you.
And one thing, Jack, you were going to update us in August regarding the specialized training in principled policing procedural justice, and they were going to bring that back into yours. I would say the same thing here. Just check. It says instructors will be attending effective de-escalation training on March 2nd, and we'll bring that training back. And then actually on the next item too, it says 3 instructors will be trained in DAT, disability awareness training, and we'll make that training available to staff members. So I would put that all together. You have the principled policing procedural justice training, the effective de-escalation training, and the disability awareness training that all had action items where you were going to have people within the department get trained as instructors and then bring that training in-house. So if you can bring.
We have a military person coming down to train our people so they can be trainers for de-escalation. So I know that part is happening for instance. And then, again, the FBI has offered to come and help us out with some of their trainers to come down and make certain that our people are trained as well. Because the goal is because, everybody's training budget, I'm sure, is tight, and then sending people out takes people off the road. We're already stretched to the max for personnel. So we're trying to keep as many things in-house as possible, hence having people come in and making certain that our people are trained and then they can train people in-house. So it's a cost savings, it's a time savings, and then, we have people who are credentialed and certified.
Right. So maybe since you're looking at that other training too, maybe in August, you can just update us on the status of all 3 of those types of trainings, just like you're saying, getting people within your department that are trained as trainers.
And Supervisor, if I could, we had an agreement with the union. We're revisiting that now that July is here. That was the date we put on it. July 1, but obviously with the holiday and everything else, we're having a meeting with the union this week where we put a halt on all training for our road patrol based on the numbers. And we didn't have bodies just to send away to training because it was more taxing on getting people, enforcing people, and so on and so forth. We did just put 7 people into the academy, which I hope everyone just saw. But we're going to revisit that with the union to free some of these restrictions up to get our people out there so we can bring it back. We are sending some jail personnel. And like the undersheriff said, we're really doing the outreach to other agencies, federal agencies and governmental agencies because they have a little bit more manpower than we do and a little bit more freedom to train us. However, we want to get this back in-house, doing our dangest to get it back in-house. And, it's very important to us as well. So we'll report back in August, but that's where we stand right now with the union, just so you have your heads up on that.
Okay, thank you. Okay, the last one on page 34, I just talked about it briefly. The current CCSO and local police department members receive training on how to effectively approach individuals with Alzheimer's disease, mental health issues, and traumatic brain injuries. Training is needed for persons with disabilities, PWD. Yellow Dot program is a free program that provides life-saving medical attention during that first golden hour after a crash or emergency. A yellow dot in the driver's side window alerts first responders that vital medical information is stored in the glove compartment of the vehicle. The CCSO will begin training 10 deputies in the DAT, Disability Awareness Training Program, to implement within the county. 3 CCSO instructors will be trained in DAT, Disability Awareness Training, and will make that training available to staff members, the Zone 14 Academy, and local police agencies in the county to help first responders. So the August update on the training, but checking in the Yellow Dot program is still in place, and any other updates on that?
At the Undersheriff's Conference, I just made contact with, there are actually 2 moms who are certified and presenting. They both have children who are autistic, and they go around the state and they train for, they train in disability awareness. So they're going to come down.
And as far as, we'll work backwards, I guess, as the Yellow Dot program, the under sheriff and I, if we're not available, one of our captains or lieutenants have been hitting as many senior meetings, as many citizen meetings as possible, talking about the Yellow Dot program, talking about, the Dark House program, where if you're not gonna be home or you're gonna extended stay at the hospital, let us know. We'll do a check. But, we're out there, we're talking to everyone from 8 to 80 about the programs we provide here at the sheriff's office. So it's been a busy summer thus far, but we've done a lot of outreach. And if anyone in your community is looking to speak with us, please get a hold of us sooner than later so we can schedule it. I'd be happy to come and talk to them. Again, with the other some of the other things you asked about as far as having the 10 deputies trained, we're still at the mercy of that training halt, and that's kind of put a crimp in what our plans were. But this time next year, we should have a pretty good grasp on our manpower. And I know I hate to put this off, for any longer than we've already have, but we just don't have the bodies to send and the ability to send them. So we're going to keep trying. And hopefully we're going to succeed here shortly with breaking free of this agreement and getting some people out there and getting trained so we can bring it back in-house.
Thank you, Sheriff. Dave, you had a question?
Just a couple of comments. First of all, I'm really impressed with the ambition of getting so many deputies trained. I think it's great, and I wish you guys the best of luck with it. And I'm distressed to hear that we've got such personnel challenges. So it's encouraging to think that a year from now we might have it. And I'm sorry for all the stress that must come with your guys' job being so shorthanded, especially with all this on top of everything. So quick question, the yellow dot, is that on a window that rolls down?
Well, it should be on a window that doesn't roll down.
Right.
Okay, perfect. And the other question, sorry.
And it's not just a car window, it's also your home. So on the front door of your house, you can have a yellow dot, rear door of your house, preferably both. Let them know that the medication's in the refrigerator or freezer. This way here, we save valuable, precious time that they have a list of medications and any other medical information stored in one place, so we can alert our EMS and deputies of that information.
Great, that sounds beautiful. And another quick question, when it comes to folks with disabilities, I've heard of instances where there are deaf people stopped by cops and they can't communicate to the cop that they're deaf, so can't really respond. Do you know if that is part of the disability awareness? I'm not sure what's recommended if officers learn a few signs. I'm just curious about that.
We don't. However, there is a program that for the hearing impaired that we could utilize. It's not often that we run into that. We did have a group of people several years ago that were having a party in the wooded area. The music was extremely loud because our deputies didn't realize that they were hearing impaired, but they had the music so loud so they could hear the vibrations. The deputies actually ended up putting the fire out, and that got the attention of the individuals there. And come to find out, it was a congregation of a camp of people that had hearing impairment, and we actually had to make some calls and then get someone that could sign to go there. It took some time, but I mean, these are all things that are coming to light that should have come to light years ago. These programs should have been instituted years ago. And I'm glad that you're acknowledging the fact that the stress level is there, that we're working, continuously 24 hours a day, 7 days a week to get these problems fixed. And I really appreciate you acknowledging that. But we also need the help of people from the community to say, hey, listen, we have these abilities. We have these abilities to sign and come forward to the sheriff's office to say, hey, we'll be happy to help. We wanted to institute a basic language program here. However, our deputies are working sometimes 16 hours a day, 5 days a week. So they're not really interested in coming to do more training on their own time to find out more about basic language, because they're using that little bit of time they had to sleep to come back and do their job safely. But we are still interested in performing these trainings, and I think some sign language would be fantastic. I used to carry a card with me when I was on patrol of different signs, and my DWI and Miranda rights I would have in Spanish and in English. We also have an app on our phone that would be able to translate. But I think it's up to the individual deputy to go ahead and take these measures. We don't make these things mandatory, but we're looking for more of these cards. We're looking for more of these ways to communicate with our citizens here in Columbia County and visitors that come into Columbia County. So if you have any access or know anyone who has access to these cards that are reparable, we'd be happy to get those. And if they're free, that'd be even better. So thank you.
The state sheriff's association just, and I don't know which county, just sent us, and it's an 8.5 by 11 sheet of symbols. And that if you find that there's a language barrier or a hearing issue. So we're going to laminate those and include those in each of the vehicles so that they're.
Oh, that
readily
sounds great.
available.
That sounds awesome. Well, thanks you guys. I'm sorry you've had such challenges. It's tough.
It comes with the job. We're happy to be here to serve the public, but I'm just glad that you guys are understanding that there's some challenges.
Absolutely. And this is a little bit of a side topic, but I'm serving on a housing commission, an affordable housing commission. And I know in the past, the past sheriff talked about the challenge some deputies are having finding affordable housing. If you guys ever want to contact me on the side, I really would like to know about the concerns of county employees and sheriff's department employees as we're gathering information about the housing shortage in Columbia County. That's just an aside. Sorry to take up time
No, that's
for
great.
this committee with that, but I'd be glad to be contacted separately about that.
Thank you.
Thank you.
So I'm actually going to stop the review here because it's 1:54 and we have a few members that have to leave right at 2. And I'm going to skip over items 2 and 3 and get to number 4 while we're still all here. We'll restart August meeting at the top of page 35 where we left off. We basically have 2 pages left. It shouldn't take a long time. Sheriff, hoping that you can get us, Rob and I, that draft body camera policy in the next week or 2 so we can get that resolved at the August meeting. We also have Elena looking into the citizen review panel. There's a real difference between an elected sheriff's office and like the city of Albany or Syracuse that have appointed chief of police as far as what is allowed and isn't allowed. And so Elena's going to do that research and come to our next meeting to present that to us. So items 2 and 3, we're going to table. And then Rob and I were talking, 1 in the afternoon is not ideal for either of us. And I know that the committee had created that day and time that worked for everyone. So I just wanted to check in with other committee members. For me, like a first thing in the morning meeting is much easier or a later in the day. And I wanted to check in with other members. Bill, you're shaking your head no.
Definitely later in the day.
Definitely later in the day.
Yes.
How do other people feel, Dave?
I'm pretty open. I'm an independent contractor. I was going to say I love the idea of first thing in the morning, but later in the day is fine as well. As it's a 1 monthly thing. I can plan around it for sure.
What about you, Gary?
I'm flexible as well. So whatever works for you guys.
Okay, sheriff and under sheriff.
We prefer earlier in the morning, so we get to things before things escalate here, address them quickly, but, we're at the mercy of the panel, so we'll refer to the panel.
Mr. Zoni?
Makes no difference to me.
Okay. So I have a few that prefer early in the morning, but can make anything work. Bill, it sounded from your response like you can't make early, a 9 a.m. work, and really it has to be an afternoon.
If it was doing it early in the morning, 10 a.m. maybe. 9 is just tough for me.
Okay. 10 would work for me. How does 10 feel to other people? Instead of halfway through the day. So could we keep it the same? I think it's the first Tuesday of the month and just change it to 10 a.m. instead of 1 p.m.
Yes, for me.
Does that work for
absolutely.
everyone? Okay, so I'll let Elena know, and Sherry, maybe you can send something out sooner than later to the public or on the website, just letting them know that starting in August, we're going to do the same day, but just at 10 a.m. So people from the public that want to attend have the heads up for their calendar.
Sure, of course.
Okay.
Happy to do
Rob,
that.
did I miss anything for
No,
today?
you did a great job. Thank you. Thank you, everybody.
Thanks,
All right.
everybody.
Meeting, and see you all in a month. Thanks.
All right,
Thank you.
thank you. Cameron, are you all set with that? Great, I appreciate it. Thank you. Have a good day. All right, bye-bye.